This is a vagus nerve activation practice that takes about an hour. So everything we're going to do now is with the purpose of activating the vagus nerve. And when you activate the vagus nerve, it basically means you activate the nerve to calm down. Because the purpose or the function of the vagus nerve when it is activated is that it helps your entire nervous system regulate, become calm, relaxed, relieve stress. And it can be done like a daily practice. Now we're going to do a longer version, but it can also be each and everything I'm showing you in this practice is something that you will be able to use with clients to teach them how to do this themselves or to do it with them if you're in a session and you're like, wow, they would benefit from right now getting calmed down. Then you can take each of the elements. So we're going to do different types of elements. Some of the elements will be with movements. Others will be with the breath, and some of them will be with sound, so that you have different options. When we activate the vagus nerve, what you will experience is that when the activation happens, the body will respond in different ways. One of the ways is that you will naturally get a sigh, like, it just happens. Or you'll suddenly have to yawn, or you will need to swallow. You'll feel this, a spontaneous swallow will happen. The vagus nerve can activate in different parts of the body because it's a 10th cranial nerve and it comes from up here. It even connects to your ear nerve, moves down through your body, and it goes all the way down, connecting to a lot of different organs on the way. When you're doing belly activation of the vagus nerve, you might experience your body suddenly start creating a lot of saliva. So suddenly your mouth will be full of water. That's a vagus nerve activation sign. Or you'll suddenly experience that you get really warm hands and feet. That also means that the belly has been activated, the part of the vagus nerve in the belly. Typically, when it's the yawning, it's the sighing, it's the swallow, we're more in the upper part of the body. So we also do practices that are both for more upper and some where we include the belly. So just have your arms relaxed, whether you have them on the knee or you just have them in your lap, that doesn't matter. And then you look over your shoulder and you see how far your head can turn over your shoulder. And notice what is the width of your movement, and then do it a few times so you're absolutely sure. Also notice if left and right side differs from each other. Okay. So in the first part of the practices that we will do, we will be using eye activation. And what it means is that I will guide you to different ways of using your arms, of having posture. But the important part is what you're doing with your eyes. So with your eyes, you will be looking, when we start and I ask you, you'll be looking to your eye corner. So if you imagine your eyes are 12 o'clock, 6 o'clock, 3 and 9, you will be looking as far as you can to 3 o'clock. So not up, not down, but straight to 3 o'clock without turning your head. So it's important you don't start following your eyes. Imagine that you are a spy. Nobody should see that you're watching them. So you keep your heart completely still, but you're really stretching. So it's as much of a stretch you can do without turning your head and without the eye starting to have serious pain. If it gets too painful, you look too far. And then you come back in the center. Typically, it's nice in the center to blink a couple of times, and then I would be guiding you to the other side. When we do these type of practices, you can stop doing it. When we do these practices, and there will be, as I said, some things we're going to do with the arms as well, you will experience that the vagus nerve will be activated somewhere in between 30 seconds and 5 minutes. And you hold these postures until you have the sigh, that feeling of swallowing. It's not necessarily the same as you did it, but you'll feel the urge to swallow. Or you're yawning spontaneously. That's your sign, I'm activated. Then there's no purpose in staying longer in it. But for some, that happens really fast, and for others, they have to sit some more minutes. Most of the time, people will reach it within 2 minutes. So what we do first is you take your right arm, you take your arm over your head, touch your ear, And then you pull your ear down towards your shoulder without pulling so much that it's painful. And then you look up to the side of your eye. So basically you have it sideways, but you're looking at the sky or at the side. So your eyes are now seeing the ceiling. And then you just keep holding this stretch. And then you notice when you get a reaction. When you get a reaction, you can let go and put your head back up. And those that haven't had a reaction yet, you just hold that. Make sure your eyes are not looking upwards in your head, but really looking to the corner of your eye. I see some of you are looking straight up in your forehead. Look to the side, so like you're trying to see your temples. Upward. So chef, if you look to the side of your eyes, almost like you're looking, no, the temple, that goes, yeah, up in the sky. That one, perfect. When you tilt, you go to the direction so you're looking upwards in the ceiling. And you, yes, yeah. Because if not, you would end up looking down in the floor because your head is tilted. Remember to breathe. Don't hold your breath. And it's a bend in the neck when the head comes down. Then we take the other arm up. So if you haven't gone there yet, just follow the group. Take up, see if you can reach your ear, and then you give a pull so that the head comes as close to the shoulder as possible, and you look up in the corner of your eyes so that what's further up would be the ceiling, not the floor. So that means you look towards the side, the ear you're holding. And you just relax your body as much as you can in this posture. And you just wait for some kind of activation. Make sure you don't twist your head. Your head is straight forward, so it's really just a side bend. Yes. And you only bend as much as you can. Remember to breathe. Relax your shoulders, both of them. And let go, we'll move on. So I can see some of you, when you do the bend, you actually do like this. Try and look at me. Instead of straight to the side, some of you do like this. You're bending slightly forward. It's very important that there's no forward movement, that it's only sideways. And that means some can move their head this, and some can come all the way down, depending on how stiff you are in your neck. So what we're going to do is we're going to do the same as we did before, but with an add-on. So you hold on to your ear, and that means you want to have your face looking straight, not your face looking down, because if you're looking downward, you will automatically end up doing a sort of half circle. And then you grab the other hand over and you grab your rib. You pull your head down, and then you pull on your ribs, almost like you're trying to create slightly C shape on your spine. And then you look up. And remember to breathe. It's not the most comfortable position. And as soon as you have the sigh, that need to swallow or a yawn, you let go, come back up. And if you're back up and the others are still in it, close your eyes and just feel the impact of it. Feel what it does to your body. Pull as much as you can on your waistline so that you really turn your spine slightly C-shaped. Like this. When you bend your spine like this, it gets like a C shape. C, the letter C. Okay. And then we take the other ear, grab the arm around, get a firm grip in your, not waist line, but in your rib cage, because you need something to pull on, and then pull on your ribs. And that means that you'll be bending even more to the side, and then you look up in your eye, corner of your eye. 9 o'clock and 3 o'clock, depending on what eye. Yes. Mm. Okay. And now you come down on your belly. So when we're on our belly, because I've got the mic in front of my face, I can't get my head completely down. But what you want to do is you want to sort of stack your fists on top of each other so that you can just rest your forehead without getting the whole head down, and that means that your nose is straight down in the floor. And just breathe a couple of times here. This is only the starting position. And it's also the in-between left and right side position. Then you come up on your elbows in a phoenix position. So the phoenix position from yoga, where your elbows are straight under your shoulders, and you push yourself a little up so that you're not slouching down here, but that you're lifted. Then you turn your head as much as you can to one side, and again look to the corner of your eyes away from your center. So if you're looking to the left, your eyes are looking even further to the left. And you will feel a bit of a strain inside the eyes, and that is perfectly okay, but it should not be painful. But it's needed to feel that stretch inside the eye. And if you yawn or sigh or feel you want to swallow, you come back in the middle, you stack your hands on top of each other, and you just put your head down and you relax a little like this, breathing normal. And if your eyes feels a little strained, then you blink a couple of times while you're here. And you come back up in the phoenix position, elbows straight under your shoulder, not slouching in your shoulders, but pushing your body shoulders a little up or away. And then you look over the other side, as much as you can turn your head. And you then look even further into the corner of your eyes. See how far back you can look. And when you have had your reaction, you come back in, put your fist on top of each other, let your head rest there. And breathe deeply. If your eyes felt strained, you blink a couple of times to support releasing tension in the eyes. And with the next one, you will be lying on your back, but I have to show you first what you're doing, so just watch. So I'm putting my back to you. We will be interlacing our hands like this, so the fingers interlaced. And when you have the skull here, you'll put the interlaced fingers so that the lower part of your fingers is following the ridge of the skull, meaning the fingers are supporting up here. And then you lie down on your back. Ah, that hurts with the mic. Okay. And then when you're here, bend your legs. Give a slight tuck upwards, so your touch on your head is so firm that when you lift a little up, you feel like the skin on the skull gets stretched and lifted a little bit. You lift your elbows up enough for you to look to the corner of your eyes and be able to see the tip of your elbow. So if you can't look very far to your side, you might have elbows like that. And if you have a very broad side vision, your elbows might be. Have your knees up in the air. Maybe because I was lying on it. So knees in the air, so your feet are flat on the floor. Like, you can only look to one side at a time. Yeah. Unless you have special eyes. And then what you do is, before we do anything, lift your elbows a little bit and just notice both left and right side. How much do I need to lift them up to be able to see my elbow tip? That's where you'll hold your arms. But only when you're looking as far to the side, and then look to the right side first. And just look as far out as you can, noticing you do have the tip of your elbow in your view. Remember to have that little tuck lift of the back of your head upwards, so it feels like you're giving the back of the head and the neck a tiny little stretch upward. The head can still rest on the floor, but the hands are having that little pull on the skin upwards, but you're resting your head, you're not lifting your head. And when you have had your response, you let your eyes come back in the middle and you close them for a little while. If they still feel slightly strained, you blink a couple of times. And then you look to the left. And again, when you've had your reaction, you let your eyes come back in the middle, you close them, and you feel. And then come back up sitting, facing my way. So again, rest your hands either in your thigh or on your knees, but you want to rest them in the same position as you held them when we were doing the first test of how far can I look over my shoulders. So you want to be in the same posture. And then you see, did anything change in terms of how far I can turn my head? And you do that a couple of times, because first time you do it, it's always slightly less. So do it like 2-3 times and really notice how just these vagus nerve activations enlarges your range. Yes. So next time you feel stiff in the neck, you know what to do. Good. So the next thing we will be doing is about the ears. So we will be putting, you have the ear above the ridge. Inside your ear, you have that weird curled ridge, and above that, there's a little hollow. Can you feel that? It's like a dip. So you want to put both fingers at the same time, or both ears at the same time. So you want to be inside the hollow. It's a little towards the front. So it's a hollow, and that also means if you, like me, have a big curl on your ear, you feel like you're tucked under that one. So a little more forward, up in the top, a little more forward. No, you were at the right place, but a bit more forward. There, can you feel it? There it is. And then you just very gently do circular movement, and it doesn't matter if you go clockwise or anti-clockwise. This is also activating the vagus nerve, but this is more what you could call indirect, because we're working on the ear nerve, and anything that happens to the ear nerve will also drizzle into the vagus nerve. And you want to do this for a minute. And you can also change direction, so you go both directions. So you have complete free choice here. And then you take your hands down and you just close your eyes and you feel the impact. Just notice your body, notice your neck, notice your head space. Then we go to the ears one more time, but now with the fingers pointing, the inside of the fingers pointing backwards, you find that opening into the ear canal, but then you touch that space just behind the opening that goes in this direction. And again, you do small circular movements with a light pressure. It shouldn't feel like a pressure, but enough to feel it in the tissue that there's connection. And again, you can circle one direction or the other. You just massage this area gently. Again, it's 1 minute. And again here, notice these little details of, oh, I felt like sighing a little bit. It's not always that the sigh is huge, but it was a change in your breath into a sigh, or a tiny yawn, or that little swallow movement, or the desire to swallow. Put your hands down, close your eyes, and again, relax and feel the impact. And now open your eyes, make Spock hands. And your Spock hands go on each side of your ear, and you're tucking up and down with a bit of a pull on the skin. So 2 fingers in front, 2 fingers behind, and you can do it slightly rapidly. Makes a little noise in my mic here. And now you slide up, tuck and hold, so you should feel a stretch in the skin. And then you pull down and you hold. And you push up with a bit of a stretch so that the skin follows. And you pull down so that you feel the skin follows. If the skin doesn't come with you, your tuck is too light, and then you can give it a little bit of rubbing again. And in total, you'll spend about a minute of this, and you can alternate between the two, the pushing out, holding a little. And when we hold, it's just like a 2-3 second hold. And then we lift up, hold a little bit, maybe just have 1 breath, and then pull down, hold 1 breath, and let go, close your eyes, and feel the impact. So for the next one, it's nice to sit on a pillow, so that you are a little more upwards and your knees can come a little more, so that you have a little more opening here in your body. So now we're going to do activation through the belly. And what we start by doing is simply just tap your belly. And it should give the sound we're hearing now. And you can swap around a little where it is so that you make sure you've been in the entire belly. And you can stop with this one. And now, hand on the belly, hand on solar plexus, and do the same, but now only on these two places. And this one you want to repeat 50 times in total. The other one was 30 repetitions. So have a tap you can feel, but not a tap so firm that you start feeling, I'm getting pain in my belly of it, then you're doing too much. So if you get pain in your belly, you keep going, but you do it softer. Then it's just because your intensity was too high. And relax. Now, nice circular movement, and make sure you do it clockwise so that you do not disturb your digestion. And you want to make 10 nice big circles where it feels like you're giving yourself a nice belly rub that feels good in your intestines. And from here, whatever is your dominant hand, you put your dominant hand on your belly button. Then you put the other hand on top. Then you make a little bit of a fist on the one that is in the inside. Then you turn it and stick your thumb into your navel with the other one supporting from the outside. And then we start pumping into the navel. Pump, pump, pump. So don't do it harder than you can handle. So if you have a sore belly button, you regulate how much. But you still want it to have that pumping impact. And at this point, try and be aware of your mouth. Some of you will already experience, I've got saliva in my mouth. That's the activation starting. Not everybody will get the saliva, but a lot will. And stop. 2. 2 thumbs in the belly button. Again, pump, 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 pump. 10. 20. 30. And then 2 fingers into the belly button. 10. 20. 30. And rest your hands on your thigh, close your eyes, and feel your body. And open your eyes. And we will move into including the breathing now. So what we start doing now is that you inhale to the count of 4. So you start inhaling 1, 2, 3, 4, and you use your nose for that. Then you close your nose, you take your chin to the chest, and you hold it for 4 seconds. 1, 2, 3, 4. You let go of the hand, the chin lock, and you exhale on 4, 2, 3, 4. And then the exhale, is for 8. So we breathe in on 4. We hold our nose. We lock our chin while we're holding on 4. And we let go and we use 8 for exhaling. So inhale, 2, 3, 4. Lock, bend your head. 2, 3, 4. Release, exhale. 2, 3, 4, 5, 6, 7, 8. Breathe in. 2, 3, 4. Lock and hold. 2, 3, 4. Exhale. 2, 3, 4, 5, 6, 7, 8. Breathe in. 2, 3, 4. And lock chin. 2, 3, 4. Let go. Exhale. 2, 3, 4, 5, 6, 7, 8. Breathe in. 2, 3, 4. Lock and hold. 2, 3, 4. Exhale. 2, 3, 4, 5, 6, 7, 8. The final in. 2, 3, 4. Lock and hold. 2, 3, 4. Release and head up. 2, 3, 4, 5, 6, 7, 8. And go back to normal breathing. Close your eyes and just feel and relax. So the next one we will be doing is a type of breath hold as well, and one where we do not breathe in until the body does, and it comes with what's called prayer hands. So first you will be breathing in normal, then you will be exhaling, and when you exhale, you really exhale. So it's not just, it's like, then you put prayer hands, and once the prayer hands is here in front of you, so elbows out, you push them together as much as you can while you have no air in you, and you stay in that position until your body goes, even if you don't want to breathe, I'm going to do it. It's starting to get difficult to talk because I'm not breathing. Push as hard as you can. Let go. So that's the way. So first breathing in, exhaling all the air out, prayer position, and then with no air in your lungs, you push as hard as you can your hands together, and you hold that tension while you hold your breath. At some point you will experience your body goes and it will remind you of the same type of breath as if you've been diving underwater and you've been, exhaling all the water and you had to hold it for a bit extra time, and when you finally come off, the body goes, finally I can take in. That's the way you want to have it done. And we're going to do 4 repetitions. So breathe in. Exhale all the air out. Put your hands together, press them together, elbows straight out. Push as hard as you can. Hold the breath until the breath sucks itself in. And then you just relax for a moment if you're out already, so that. And with each round, you should be able to go further. So take a deep breath in. Exhale all the air out. Push your arms in prayer, push them together hard while you hold your breath. Or hold the lack of breath. Keep pushing. And you want to push yourself a bit more than you like, so that it really becomes the body saying, and not you saying, oh, now I'm going to let in air. So really wait to the moment where the body chooses to suck it in. And you might experience slight discomfort because, oh, I'm holding my breath long. Take another breath in and really blow out all the air. All of it out. Push your hands in prayer, push together. Keep your mouth closed. It's easier to not have air come in then. And the prayer position is very important with the pressure. Without that, you're not going to get the same impact. Take a couple of breaths. And for the last and final round, take a deep breath in. Exhale everything out. Prayer, push together with no air in your lungs. Hold it, but keep pressing. Close your eyes when you're out and feel the impact of it. Rest your arms. And make a little note for yourself. Whenever I stopped with the prayer hands, did I have more air to push out first? Or did I go straight into sucking the air in? If you experience that you could still push air out or exhale, that means that you hadn't emptied your lungs fully. And then if you do it again, next time you want to make sure your ears are completely empty before you go into the breath hold, so that it does become this in of air, just like when you come up for air from underwater. So from here we're going to move into using the vocal tones, meaning we're activating the vagus nerve through the use of our vocal cords. And we start by different things. The first one is the sound of and it's with closed mouth. And I invite you to really notice what part of your body does get activated. Is it your belly? Is it your chest? Or is it your throat that you feel the major or the most activation in? So the activation should be felt mainly in the belly, and of course you will feel your vocal cords, but you should feel it in the belly as a low vibration. From here we move into an open mouth saying ah, ah, and know where the activation comes from. Feel, is it lower chest or upper? And you may stop. And the next sound is the sound of ooh, as in you. Ooh. Again, notice, is it belly, chest, or throat activation? Ooh. 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 come to a completion. Close your eyes and just feel what it's like to be inside of you right now. Now place your hands on your lower belly. And we'll do the sound again. And this time also allow yourself to feel it through your hands. Move your hands to the chest and do the ah sound. Ah. Try and do the sound gentle. Gentle, so lower, not so high, more like ah, gentle ah. Put your hands on your heart for the ah sound. Loose, put your hands on the heart for the ah sound. Ah. And move your hands to the throat and do the oo sound. Ooh. Relax your arms, close your eyes, relax, and just feel the impact. Notice the state of your body. So in the next one, we're doing something that's called diagonal breathing. But before we go into diagonal breathing, we'll be standing up shortly to do an assessment. Stay seated while I explain. The diagonal breathing is a breath form that can release a stuck pelvis and lower back pain. And it can really do it in big ways, even if people have had chronic pain for a long time. Teach them to do this daily, and most people will come after a week and say, my pain is gone. So, but we're first going to stand up to do an assessment of ourselves. And when you're standing up, you cross your arms over so you're holding onto your shoulders without moving your shoulders away from being right above your knees and your feet. You want to push out the hip as far as you can do, but not move, and see what is my range. Make sure you don't do like this, that you really keep your shoulders right above your feet at all times. So it's just a question of how much can my hip come out to the side. But my shoulder stays where they are. Do it a couple of times and you will notice that you will most likely have more range to one side than to the other. But notice what your range is, because this range is showing what level of lower back tension you're holding. If you can't move your hips equally, one side of your pelvis and lower back is stuck and the other one is less stuck. And if you just notice that I can't move it out very much, then you're stuck on both sides, even if you feel, but it's equal left and right. Now come back down, lying on your back, with your knees up towards the ceiling and your feet on the floor. And then you put one hand on your hip bone, and the other hand on your heart. So you have this diagonal line going from your hip to your heart. And then what you do now is you close your eyes and you just feel, what does my body feel like? And just relax into this position for a moment. Now imagine that you're taking a breath in, but the breath will come in through your hand into your hip. And when you exhale, it will cross across the body and come into your hand and the heart. And when you then breathe in, now it goes from the heart to the hip. So the first breath, breathe air into the body, exhale the air up to the heart. Breathe, that air now goes from the heart to the hip. So your breathing will feel like it's going up and down between your hip and your heart hand. And you breathe in your own tempo, your own pace. Some of you will breathe slower, some will breathe faster. So just find your own pace as long as you have this breath that goes across your body between your hand and your hip. Make sure your in-breath is through the nose, and if you can, keep everything to nose breathing. If you can't keep everything to nose breathing, you can exhale through the mouth. Letting the air constantly move between the hip and the heart. And the placement of the hands and keeping them there is very important for the impact of this practice. Now swap your hands around so the one hand on the hip comes to the heart and the heart hand comes to the hip. So just do opposite of what you did just before. So when you hold your hand on the hip, your forefingers is pointing towards your belly. Yes. And then again breathe from the hip into the heart, and from the heart into the hip. And you breathe in your own pace, and you make it just a nice, relaxed breath. Nothing forceful, nothing controlled. Don't count. Just allow the breath to move in its own pace from the hip to the heart and the heart to the hip. Now you can just rest your hands down the side for a moment and just be you however you are. Whatever form being you looks like. And open your eyes again. Come to a sitting, and from the sitting come to a standing. And now when you come up in a standing, you cross your hands over again, you tuck and hold on to your shoulders, you make sure your shoulders stay above your feet at all times, and you test the range of your movement. And you let your hands come down on the side, and you give yourself a cheer. This is the end of the practice.